Number 5, okay? This one might go over well for some and for others it won't. All right? But enforced bedside report. Yes, enforced bedside reporting. A lot of times, I'm going to be real, a lot of times the nurses who don't want to do bedside report is because they don't want to give report in front of the patient. And there are some times when, that's appropriate, but it's not most of the times. A lot of times if I'm going to give report and I know there's something in the report that may be a source of contention or issue, I might save it for after we walk out the room and like, hey, I wanted to say this, but I didn't want it to be an issue in front of the patient. Or I say it to you before we get into the patient's room, like, hey, I'm about to give you a bedside report, but I just want you to know something that happened last night. Or I want you to know that, whenever this topic is brought up, or, if there's a family issue, whatever the case, whatever I feel like is sensitive and just need to be said, I'll either say it before or after the report, but I pretty much like to give bedside report. And I found in my career that a lot of times nurses who are adamant about not giving bedside report, you're going to find out that it's going to be to your detriment. All right, I like getting bedside report because as you're giving me report, I'm scanning the room, There's another specific time to do that, but as you gain experience, you're just gonna be able to do several things simultaneously. If you're telling me the patient's on fluids, I'm looking at the fluids, right? I'm looking at the bag, I'm looking to see how much is in the bag. Because a lot of times those nurses who want to give you report outside is gonna leave you a dry bag. She's going to leave your tube feeds dry, empty, only 10 cc's left in it. The patient's room is going to be a hot, complete mess. Trash is going to be overflowing. Laundry bag is going to be filthy. Patient's going to be lopsided in the bed. Plenty of times, most of the times when I have nurses who are just so adamant on not giving me bedside report on any of the patients for any reason and every reason, I'm telling you, they're the ones that's going to do you dirty. Because if your bag is running dry, you're going to want to be like, hey, do you mind grabbing me another bag before you go? Or another thing why you should be doing bedside reports so that you can check those lines. Listen to me and listen to me clearly. If you take a heparin drip patient or you take a patient that's on a titratable drug, even if that nurse left, once you take report, you're taking responsibility for everything that's going on. And the expectation is that you are supposed to check the pump, check the fluid, check the rate, check everything. Once they're gone, if later on someone says, hey, I found the bag running, I found this heparin drip running at this rate, or I found your fentanyl running at this rate, and then the computer says this rate, you can't say, hey, well, no, that was a night shift nurse that did that. Yeah, but you assumed care of that patient. Because you're supposed to do bedside report. You're supposed to sign off certain drips. Or if you don't have to sign off the drip, you're supposed to check the lines of the drip or of the fluid saying that it is going at the right rate as what the order said. You know what I mean? There's times that, I get report that, hey, it should be going at 100 and it's really going at 250. They had dropped the rate 4 hours ago and the nurse never saw it. And you assumed report. You assumed care. There are times that it's going to say that the heparin drip should be going at 15 and old girl got the heparin drip going at 22. I'm telling you, I'm not making this stuff up. There's plenty of times that the insulin drips is saying that it should be going at 2 units per kg per hour, and you should have dextrose going at 250. You should have D5 going at 250, but the fluid is still normal saline. I'm just saying, and now, the patient's not waking up. I'm just saying, when you take report on a patient, you're assuming care, and you're saying that whatever the state that the patient that you received in is, you were in agreement with it because you should have done bedside report. You know what I mean? So I'm just telling you, it helps you to set your day up for success. Or even if it's a nurse that I know is going to be a tussle for her to want to go and grab me a new bag, I can then, depend on the bag, she has to go get it. Because if it's like a heparin bag and you're leaving me a heparin bag dry, you have to grab another one. I'm not even signing off with you. Go, let's start another bag. You know what I mean? Or if it's like a antihypertensive, like a Cardine drip, or you know what I mean, if I'm signing off propofol with you, or I'm signing off something, and I can't manage to run out on my shift while I'm giving report, you know, or I'm getting report. No, you want, oh, let's sign off the propofol drip. Ma'am, there's only 5 cc's in there. Let's grab a new one, or I'll just like, oh, I'm gonna grab a new one because that one's dry. And we can sign off with it, because certain medications you have to get a 2-person sign off anyways. Okay, so please, bedside report is for your good. It does not harm you to do that. Okay, you want to advocate for yourself, do bedside report. Encourage bedside report. Be like, if a nurse says, oh, this is what's going on with this patient, so I don't want to give bedside report. Okay, tell me about that situation now outside, and then we can get report. We can give me report on the inside. Advocate for yourself. You want to do bedside report, okay? A lot of times bedside report, the patient's like, I've been asking for pain medicine all day and I'm still in pain. And then I'll say to the patient, and I'll ask the nurse, hey, does the patient have pain meds due? Oh yeah, he is dilaudid, ordered Q4. Okay, when was the last time the patient got it? Oh, I gave it to them at 10. Ma'am, it's 7 o'clock. The patient said that they've been asking for pain meds the entire time. Is there a reason why it hasn't been given? No blood pressure issues?